maybe you just introduce myself and then I'll just say, yeah.
Yes.
Okay.
Hello, everyone, and welcome. My name is Angelina Ceja. I'm the Director of Education for AgSafe, and I'm here with my colleague Rosie Cano, and we're going to be talking a little bit about her experience as someone who went through COVID-19 as an employee. So welcome, and thank you so much for joining us.
Thank you, Angelina.
All right, so I'm going to have a couple of questions for you, and just answer as best you can. Remember from your experiences.
Of course.
So I want to know kind of what you were doing in terms of minimizing your exposure to COVID-19 prior to the incident.
So prior to becoming exposed to COVID-19, I was following all of the precautions, that were out there that the CDC provided, our local county, and more than anything, my employer. We immediately, provided people with a lot of resources on what to do, what not to do, and so forth. And so I was doing it all from wearing a mask every time I went out, only going out for my essential needs, sanitizing frequently, wiping down the most commonly used areas, even in my household, because my husband is still going, he was still going out to work every day. And whenever I came in and out of my home to buy whatever needs, we had, I felt as if I was exposing myself and to people in my home. I do have an 80-year-old father and a daughter with a chronic illness, so I was very mindful of what I was doing.
Perfect, thank you. So how did you go about retracing your steps once you realized you were exposed? What were some of the things you did or looked at?
I went back really to, I think people would always, well, personally, I questioned myself. Where did I go wrong? What did I do wrong? What did I not do? And so, becoming ill and then having that weigh over me was very difficult. And I just had to just really retrace my steps. What places did I visit? What did I do after I found out I was positive? I had to contact the stores that I had visited, and then just try to figure out. It got to a point where I couldn't focus on that anymore. I had to now focus on taking care of myself and my family, because eventually others in my household also became infected, and so now there was work to be done within my home.
Great, thank you. So when did you start feeling sick?
I suffer from year-round allergies and sinus issues. It is nothing new to me, to my family, my coworkers. Everybody knows that I suffer with this. And so the symptoms that I had initially were that of, allergies and sinus issues, a lot, I think, stronger than the norm. And so that became questionable. I immediately scheduled an appointment with my primary care physician, thinking it was probably an infection, but I didn't have a temperature to come with it. What was abnormal was the sore throat. And then from when I began to feel that sore throat, the day after, I did wake up with the temperature. And so that to me were symptoms that I had not felt when I dealt with sinus or allergy issues, unless I had been diagnosed with a sinus infection.
So when did you make the decision to get tested? I know sometimes that's a little bit of a waiting game. So how did you decide, or when did you decide?
For me, again, I questioned whether or not I could have had COVID-19 because of all the precautions that I took. Again, sanitizing, constantly washing my hands, wearing a mask. I initially did not think that I had become sick with COVID-19. And so what made me go to get checked was thinking about my daughter with the chronic illness, thinking about my father, and not only that, but really thinking about everybody else that I would expose if I indeed have this you know, and not know. You know, maybe my symptoms were not going to get worse, and so I would have continued with going out and making my grocery runs and whatnot, and along the way I'd be infecting other people. So that is really what, you know, and eventually made me go to get tested.
Perfect. And then can you talk to us a little bit about the process of, informing your employer and any support, or how that went when you received your test results
My
back,
test
and even in your process?
Okay.
Yes.
Well, when I went to go get tested, I had already scheduled an appointment with my primary care doctor. So while I was there waiting to get tested, he called. We had a video, appointment, and he said, you did the right thing. Once you get your results, you will receive a letter from us in the mail and online. So it'll be a letter that you are able to provide your employer. On the day that I went to go get tested, I did call my boss, and I did inform her of how I was feeling and that I was coming in. The next day, after I got my results, I received an email, documentation letting me know that I tested positive, and to forward a copy to my employer so that they were aware. So that is what I did. I informed my employer. I have to say, she stayed on top of everything for me, checking in on me. How was I doing? Did I need anything? And not just Teresa as our president CEO, but I think everybody else on staff was just, because again, I was the one making those runs in my household, and now I could not. So.
Right. And then talk to us a little bit about, the process in terms of, did you receive any paid time off? Just so that people are aware about what's available for employers. So
Yes.
in terms of your time.
Yes. So I immediately, upon receiving my positive results, the next day I received a phone call from my medical provider, and it was actually the doctor that did a small examination on site before I got my test. She just called to see how I was doing, see if my symptoms had gotten worse. Just gave me advice on if they did, what to do, how to go to the emergency room, because I would no longer just walk in, and so forth. And then additionally, when I received that paperwork and forwarded it over to my employer, I was immediately told, you're quarantining for 14 days. You will be getting your paid sick leaves. You're entitled to the 80 hours. And just let me know. She was also going to, she did tell me she would file paperwork for workers' comp, because I had an event the week that I became ill. So she just wanted to ensure that all of our bases were covered and that I was being protected and that I had what I needed during my time off.
Right, perfect. So during that time when you were out, so did anyone contact you? Did you receive contact from any agency, or, what's the expectation of calls you might perhaps receive, or communications you were receiving?
Yes, so at that time, I know the state was, and I don't know if, I think it was a state or the country, had, there was a scarcity on tests. And so they were very behind on giving people their results, documentation, anything in writing was running late, but they did have people on the phone. So again, my medical provider called me on immediately 2 days or the day after, and then they called me again within that 14-day quarantine period. I received a phone call from the California State COVID team. They took a lot of information, asked a lot of questions. They were more concerned about symptoms, and they were just writing down everything, asking if I had any symptoms, and then after I shared the symptoms I did feel, they had follow-up questions to those. The Stanislaus County Department of Public Health also called, and also they were more concerned about where was I, what places I had visited, have I notified those locations, and so forth. Around, I think, the 12th day of my quarantine, The California COVID team contacted me again, asked again questions about my symptoms, how I was feeling at that point, and at that time is when they cleared me for COVID once I wasn't showing any type of symptoms. Initially, they did advise not to leave my bedroom or whichever room I was using in my home to quarantine until I had 3 days of no temperature without having to use any type of medication, and not to leave that room until 10 days of being symptom free. I did learn during that time, Angelina, that every county has different regulations around those time periods. So that is one recommendation I would make to anyone, is to look into your local county and find out what that looks like.
So anything else you want to share with us in terms of your experiences with COVID-19, any sort of takeaways you have potentially for individuals in terms of that?
Well, what I definitely learned was, regardless of how right you're doing everything and following the guidelines and the recommendations, it can still happen to you. It can happen to anybody. It happened to me, and I think in my entire family, I was the person that was very strict around who came to my house and who, where my family went and how often we got together. Even though my family is small, I mean, we hardly ever have gatherings. Being very mindful around how I'm handling myself and what I do when I'm coming from my home. It still happened, and I think it was a big learning experience. It made me want to dive into the resources that are out there a little bit more, and then more than anything, talking about it, because it almost became a shameful thing for people to talk about, and this isn't anything that anyone needs to be ashamed about. It is out there, and if we are not careful and follow the recommendations that are out there, it can happen to us.
Are there any recommendations you have for employers in terms of when they're working with their workers, and again, watching this hopefully, as some lessons learned, but anything you could provide in terms of guidance for employers as well?
I think for employers, I would definitely say, just be more mindful of your employees, and I'm not saying that they are not, but it's great if they are providing the PPE, if they are providing the resources and the guidelines and the trainings and so forth, but are people being monitored? Are people really being monitored? Not just with their work performance, but are they wearing the masks? Are they washing their hands correctly? Are they using the sanitizer that you are providing? Because again, after having had been sick with COVID, Angelina, I still have to go do our grocery runs and everything for our household. I am now paying attention to people more, and more so employees of the stores that I visit, because it doesn't do us any good if a store or a restaurant says that masks are required upon entry, and then you walk in and employees are not wearing their masks. And I could only imagine that if that does happen in our local grocery store, then it's happening everywhere else, and it's because of people not being monitored, and it's unfortunate that we're all adults and we all should know, right? But again, it's difficult for workers, being out there, working and then having to wear a mask if that's not what they did all the time. But just being more vigilant, about what they are actually doing or not doing.
Well, I want to thank Rosie and all of you for your time and attention. This is an important topic, and in particular, just for everyone out there, just the reminder, employers have protocol. Follow the protocol that your employer has. As an employee, the reminder to socially distance, even during your breaks and your lunches. And then additionally, sometimes we also have to think about our outside activities. Are we taking greater risks by going to the birthday party or going to the other event that perhaps is indoors and not socially distanced and not wearing masks. So just as a reminder to all of you to continue to stay vigilant, and thank you very much for your time. Thank you very much, Rosie.
Thank you, Angelina.